Morning, everybody. This is Dr. Raghavendra here. I'm a director at the Central Council for Research in Yoga and Naturopathy. This is an autonomous body under Ministry of AYUSH, Government of India. And I welcome all of you for being here at such a short notice to share your views on role of yoga in oncology. I'm very thankful to League for leading this, taking this initiative and putting things up in such a nice way. And we would like to have this is a small session where we would like to ascertain all your views on how you are implementing yoga in oncology, especially in US. So we are having a symposium. We are going to be having a video which is going to be made out in the Ministry of Ayush. This video is going to be recorded and this is going to be played and this is going to be edited and then played across on 8th of this month in the evening, and we'll let you know the time and date, etc. And we'll also make this recorded video available to all of you as well. So this is basically to take in a nutshell to understand how yoga is popular across the world where it has been used for treatment of cancer patients, especially in the field of oncology, be it during treatment or during survivorship or during palliative care, and trying to ascertain the views of all the researchers, the therapists, the doctors, the clinicians, and psychologists on the role of yoga in oncology. So with this, I'm over to Liberal League to talk and introduce all our guests who are there here and experts who are there here who are dealing with cancer patients. And we request you to kindly take over the proceedings, League.
Thank you, Dr. Raghavendra. Thank you for organizing this very important meeting. And today, this is in recognition of World Cancer Day 2021. And so we're very happy to contribute to that. And we say hello to our friends in India at AYUSH and CCRYN. The Society for International Oncology is a multidisciplinary professional organization whose mission is to advance evidence-based integrative practices to improve the lives of people affected by cancer. And we here today on Zoom are many members of the Yoga Special Interest Group for the Society. And we are excited to share some of our ideas about yoga and oncology, and hopefully this will be the beginning of a collaboration and partnership with our friends in India. And we thank you so much for sharing the gift of yoga in the United States. So I want to begin by introducing the people that are on the Zoom call. And I'm going to start with Dr. Lorenzo Cohen, who is our co-chair and advisor of the Yoga Special Interest Group. Dr. Cohen, if you would just take just a minute to introduce yourself and
Sure, thank you. Thrilled to be here today to be able to have a discussion around yoga and cancer. My name is Lorenzo Cohen, and I'm director of the Integrative Medicine program at the MD Anderson Cancer Center. This is a large cancer center in Houston, Texas, where I've been directing this program, doing research in particular in the area of yoga and other mind-body practices for over 20 years now. You know, I think as we'll talk about today, yoga is one of those practices, along with other integrative modalities, that needs to be integrated alongside conventional care as the standard of care.
Thank you, Dr. Cohen. Smita, you want to go next?
Sure. Thank you, Lee. Namaste, everyone. Very happy and excited to be here. My name is Smita Malaya. I work as a senior yoga therapist, a mind-body interventionist at the Integrative Medicine program at MD Anderson Cancer Center, where I've been fortunate to be mentored under Dr. Lorenzo Cohen. I received my training from SVyasa, Bengaluru, and for the 10 years past, I'm at MD Anderson, but being a yoga therapist for close to about 16, 18 years now. Glad to be here.
Thank you, Smita. Dr. Bethel, Kelly.
Hi everyone, I'm Kelly Bethel. I am currently the clinical director at the University of Maryland School of Medicine Center for Integrative Medicine. We provide services in the Stoller Outpatient Clinic. I am a certified yoga therapist and also hold a doctorate of physical therapy.
Thank you, Kelly. Bina.
Hi, everyone. Thank you again for having me. My name is Bina Patel. I am currently a physician assistant in oncology, but I also have a yoga for cancer training so that I could pursue teaching yoga to some of my cancer patients. And yeah, I think yoga is incredible and it's definitely helped a lot of patients with different symptoms. And I think the way that we're headed is that a lot more patients are becoming interested in a lot of mind-body techniques and asking about yoga and other practices. So I'm happy to share any input today. Thank you.
Thanks, Bina. Suvina.
Hi, my name is Savina Guglani, and I'm a medical physicist / yoga therapist in Houston, Texas. I do practice like Dina, the yoga therapy with my patients when I meet with them and work with them. And I find some of the mind-body techniques that we use, especially breathing techniques, really are helpful in terms of managing some of their symptom-related issues that they might have, which we will talk about today. So nice to be here. Thanks, Lee, for the invite.
Thank you, Savina. Sunmay.
Hi, my name is Sanmay Mukhopadhyay. I almost forgot how to pronounce my last name. But I'm in Los Angeles. I've been with the County of Los Angeles. Actually, I was the CIO of their Department of Health Services. I have been trying to integrate at least, not I would say totally integrating, but trying to integrate yoga into various phases of the disease, from early diagnostic phases to late stage. I'm associated with several nonprofits in this area, helping more than a therapist, as a healing, as a person, as a last right counselor. So at different phases of a cancer patient, early diagnostics, interception, to all the way to the last phases of a heavily metastasized condition, including the passing away. So that's my role, more as a counselor. Of course, all the techniques we use, different techniques for different types and at different stages. And that's about it. I'm happy to be here. Thanks, Lee and Dr. Rao, for arranging this.
Thank you, Sunmay. Anne.
Good morning from Canada. I'm Ann Pittman. I'm a certified yoga therapist and research consultant at the Ottawa Integrative Cancer Center and the director of the School of Embodied Yoga Therapy. So working on an integrative team here, from diagnosis and actually doing quite a lot of work with yoga therapy at the end of life as well. Thank you.
Thank you, Anne. Tanya.
Hi, Lee. Thank you. Thank you, Dr. Rao. My name is Tanya Culp. I'm a certified yoga therapist. I'm here in Philadelphia, and I am employed with the Children's Hospital of Philadelphia. Our integrative medicine program is working in conjunction with our integrative oncology program, and we work from diagnosis through end-of-life care, inpatient, outpatient, and still providing some telehealth. Primarily focused, I would say, on, or trying to focus a little bit more on the older adolescent population, but still working across the age continuum.
Okay, thank you, Tanya. Doreen.
Hi, thanks, Lee. My name is Doreen Stein-Cerusi. I'm with Lineberger Comprehensive Cancer Center, which is part of the University of North Carolina. And I've been working with cancer survivors for almost 17 years. And I've done the range from newly diagnosed, right before starting radiation, outpatient, working a lot with helping people get through treatment and important meetings right now, because it's all virtual. And starting next week, I'll be in the hospital, back in the hospital doing inpatient yoga therapy for cancer patients there. So I'm looking forward to that beginning and a little bit of normalcy from COVID. I'm excited for that. Thank you. Looking forward to it.
Thank you, Doreen. Nancy?
Thanks, Lee. I'm Nancy Sinton. I'm a certified yoga therapist in the Integrative Medicine Department of the Orlando Health Cancer Institute in Orlando, Florida, working with teaching yoga to cancer patients as well as a research project.
Thank you, Nancy. Sandra?
Hi, good morning, everyone. Thank you, Lee. Thank you, Dr. Rao. This gathering for me has been a long time coming. My name is Sandra Gilbert. I'm in Nashville, Tennessee, and I currently work at Vanderbilt University School of Nursing, where I work on a team with research in yoga for breast cancer survivors, and our current project, which is yoga for children with cancer and their parents. And we did have to go all virtual. I'm also the director of YCAT, which is yoga therapy in cancer and chronic illness, where I train teachers and yoga therapists to work safely with people with cancer. And I've been in this field for using yoga as a therapeutic modality for 20 years, and specifically in oncology for 19 years. And so I'm really excited to be here and be a part of this discussion in our future. Thank you.
Thanks for joining, Sandra. And last but not least, Tina, right in the middle of my screen.
Good morning. Thank you. I'm Tina Walter. I am in Cincinnati, Ohio. I'm a certified yoga therapist, and I trained with Yanni Chapman. And that was a long time ago. But for the last 10 years, I've been providing inpatient and outpatient yoga therapy interventions at 3 different hospitals in Cincinnati. I subcontract. One is the University of Cincinnati. They have a rather large integrative department. The other 2 hospitals really don't. I also teach classes for the cancer support community, and I'm very honored to be able to teach yoga, this beautiful practice. I hear daily from my students and my patients how much this practice helps them during their cancer journey. Thank you.
Thank you, Tina. And also Dr. Santosh Rao, who is our co-chair of the Yoga Special Interest Group, could not make the meeting this morning because he's in clinic with patients, but he sends his regards. He is a medical oncologist at Banner Health MD Anderson in Arizona. And my name is Lee Leibel. I'm in New York City. I am at Columbia University Medical Center at the Herbert Irving Comprehensive Cancer Center. And I have my yoga training from SVSA in Bangalore. I have the Master of Science. And so I'm excited to bring the best of the East to the best of the West. So let's get started with this. We have some questions that Dr. Raghavendra has asked, and I'm just going to say a few words to start. So when we're working with the cancer population with yoga, we know that there is a continuum of care. It starts at the diagnosis, then it goes through treatment, and the treatment could be surgery, chemotherapy, radiation, hormone therapy, immunotherapy, targeted therapy, or a stem cell transplant. And then we have the next phase, post-treatment, which could be cure remission, or it could be living with chronic disease, where cancer is managed just as a diabetes or a cardiovascular disease would be managed. Then we have recurrence, when the cancer is treated and it comes back. And then we have end of life. And we recognize that yoga and yoga therapy has efficacy and application for every single stage of this cancer care continuum. And the yoga can be delivered in so many different locations, in the hospital at the bedside, in the chemotherapy suite. It can be as part of the experience in the hospital while you're waiting for your appointments. It can be in a special room or an auditorium after hours. It can also be delivered in the community. So our most important concern is accessibility. How do we bring the gift of yoga and all of its benefits to every person who is affected by cancer? And how do we do that safely? We know that cancer it's so many different diseases, and these diseases affect different body parts. The treatments for the disease affect the body parts. And we must know about the progression of the disease, the impact of the treatments, and how we can keep our patients safe within our yoga practice. So the themes that keep coming up with our group are, of course, the accessibility. How do we provide it in hospitals and in communities? How do we get funding? How is it paid for? In the United States, there are basically three models. One would be that the hospital or the healthcare system pays for it. The second would be that the patients pay for it. And the third is philanthropic money or grant money that would pay for this yoga intervention. We also know that many cancer patients have comorbid conditions. They are often a medically fragile population. This could be diabetes, cardiovascular, arthritis, osteoporosis, along with all of the mental health issues. So how do we as yoga therapists and yoga professionals deliver this safe and effective intervention to our patients, mind, body, and spirit? Because we all know yoga was developed 5,000 years ago to end suffering. And so what more beautiful way to help a person affected by cancer have a better quality of life through their treatment experience. Of course, COVID has influenced us. We've gone from inpatient to virtual delivery, and there are challenges there. And the misconception about what is yoga. In America, many people think it's the physical practice. So we really need to create awareness, not only for the general public and our patients, but also for our doctors and our nurses to understand it's much more than just, the asana. Okay, and I will stop talking. And I will open up to our expert guest. And why don't I want to hear from each of you, like within your practice, in your hospitals, in your clinics, or your private practice, what are some benefits that the patients are seeing? And what are some of the challenges that you are experiencing as the yoga therapist? And I'm going to start with Anne. If you could just maybe 2 minutes.
Oh, no chance to think, hey? So the question was, what do people experience? What's the benefits?
Yeah, what are the benefits? What's the feedback from your patient population or your client population? And then what are some of the challenges that you find working with yoga? Whether it's a systematic thing with a systemic thing with the institution, or safety issues,
Well, I think one of the most obvious benefits is after a diagnosis of cancer, you can have a very out-of-body experience, and with shock, etc. So working from diagnosis, the capacity to allow people to come back to themselves in some way initially, and with regard to anxiety and insomnia and all of those things that we can truly affect with movement and breath and philosophy of yoga, etc. So I think initially, and I think when I'm an integrative team, many people are sent to me for that, for shock and the ongoing effects of shock throughout their cancer treatments. So a lot of that work is there, certainly with all kinds of side effects, fatigue, pain, the trauma really of the diagnosis that we can, I think, have such an early start with yoga therapy with regard to, you know, softening the trauma of this. And of course, at end of life, which is a place, you know, with breath and movement and impermanence and all the practices that we have that we can offer at end of life. But I think this accompaniment, you know, a human accompaniment, the possibility that we as yoga therapists who have a wide practice, I'm sure, with regard to nervous system regulation, and that we can provide co-regulation with people who are so frightened and just don't know even how to think, put two thoughts together sometimes after that shock. So with regard to the work of yoga therapy, I think that there is not, as you say, Lee, not a lot of knowledge with regard to the vast width of yoga and what can be offered. And so sometimes I have posters that have like a downward dog on it. And that's like, I'm not gonna give you 10 downward dogs and call me in the morning. So you know, how can we encourage people to understand the, you know, the tenderness and the engagement that is a little bit different with yoga. In our clinic anyway, people come and they receive, you know, wonderful medical treatment and beautiful massage and all things that they can take in. But yoga therapy, I think, is one of the only therapies that asks for engagement from our clients. And I think that's such a beautiful human capacity and step that we can accompany people with. Yeah. I won't take any more time.
Thank you, Anne. That is so beautifully spoken. And I think that many people aren't aware that yoga really can address the anxiety, the depression, the pain, the fatigue, the fear of recurrence, and really the emotional trauma, as well as the physical trauma to the body, but the emotional trauma of receiving a diagnosis. You have cancer. I think another important point you make is end of life. Many people don't understand that yoga therapy and yoga is a beautiful practice to introduce to people in hospice and the end of life. And especially for many countries around the world that don't have palliative care programs, how can we integrate these yogic techniques into palliative care programs to provide pain relief, physical and psychological, spiritual, existential pain relief? So that's, I think that's something we really need to include in our awareness campaign. I am now going to go to Smita. And Smita, the question is, in your practice working with cancer patients, what are some of the benefits that you've seen that your patients are reporting back? And what are some of the challenges that you are facing?
Thank you, Ray. I think talking about if we begin to address some of the benefits of the yoga in cancer population, as Anne mentioned, it is so vast and huge, but maybe talking from a perspective of a yoga therapist or a person who would like to apply, an important part would be really placing the control back in cancer patients' hand, which is huge. One of the real characteristic of cancer and cancer diagnosis is people continue to feel that they absolutely have no control. Anticipation, wait, the side effects, I didn't know this continues on. And a lot of times, especially during the treatment mode and the initial prehabilitation modes of cancer, one of the things that I continue to encourage my cancer patients is, just like you take a pill and you have certain outcomes, you do these practices and know that you can control some of these outcomes that are coming because of treatment side effects or other reasons. And that definitely encourages cancer patients to continue or adhere to some to a great extent to their practice, because now they can control how they will feel post radiation if they do these stretches. They can control how less or more anxious they can feel on the radiation table if they do certain pranayama techniques. So I think this is a great part of the patient education in when we introduce yoga practices, that the benefits can be controlled by their own practice in how they do. And another quick point I would like to address would be the adaptability of these yoga techniques. No matter where you are in the cancer diagnosis and treatment, a lot of times, people say, oh, she's just diagnosed, she will come to yoga therapy after everything is done. Oh, she's done with, treatment. I don't think she has anything to do with yoga. And that continuous education piece is that no matter where you are in the journey, even if you are at high risk for cancer, we can help. And even no matter where you are in the journey, even if you're a survivor and it has been many years, yoga therapy can address that lingering trauma and other things that are associated. So I think I'll touch upon those 2 points. Of course, there are more. And coming to challenges, as you said, the word challenge, one of the words that I put down on my note is patient education. And in fact, this applies to education across the board, from providers, oncologists, patients, and to some extent, even some yoga instructors and therapists, continuing to educate ourselves on the research, the possibilities, the techniques, and most importantly, I think for patients. If patients are convinced that this can be part of their cancer care, we, I think, have a larger scope to go into, and institutional supports and other things, of course, play an important role. I'll hand it back to you, Lee, since we have a room full of experts. Thank you.
Thank you, Smita. You brought up some interesting points. I just want to do a follow-up. So we know that when patients go through cancer treatment, the chemotherapy, radiation, etc., there are, of course, acute side effects. But these side effects can linger even after the treatment starts or stops. They can also be late effects. So you could be finished with your treatment and then maybe a year later, you start to have side effects. And so the beauty of the yoga practice is that this can accompany the cancer patient along all of these different stages. Smita, 2 things. I know you're doing groundbreaking work with prehabilitation and with dyads, the family unit. Can you just, we could spend an hour talking about this, but can you just quickly talk about the importance of prehabilitation after diagnosis and the importance of working with the family?
Surely, thank you. So prehabilitation is a model that is used usually in musculoskeletal surgery populations, where they prepare patients for the surgery so their surgery outcomes and recoveries can be great. So this is a new idea I'm continuing to explore along with my colleagues at MD Anderson and with Dr. Cohen, that can we prepare and prehabilitate cancer patients at the stage of diagnosis, as soon as we find, so that we know their trajectory and prepare them using yoga practice. And yoga, I think, is perfectly fit because it excellently addresses the overall health and well-being. Because we can prepare for surgery with muscle work and movement, but also we need to prepare psychologically for the anxiety, depression, uncertainty, and so many more things that they face, which may even help reduce the trauma of the cancer and the burden of cancer itself. So with that, I think maybe with SIO SIG, we can continue this work, that how we can look at a prehabilitation model for cancer as well. And the second that Leigh mentioned is the work with couples and caregivers. Here at MD Anderson, it's the work of Dr. Catherine Milbury and colleagues, where the caregiver or the family of the cancer patient is often overlooked. We continue to focus on patients, which is very important, but we know from literature that caregivers and family members can have equally significant clinical burdens of trauma and other symptoms that are there. So in our work, when we brought both the patient and the caregiver together, we see that not only the patient benefits, but also the caregiver benefit. And we have this model of caregiver stress impacting the patient distress, and the vicious cycle continues to go. So we can break it at both points, addressing the needs of both parties. And again, yoga is an amazing tool. The adaptability and the way that we can address needs of both the parties, patients and caregivers, is great. So please continue to look for that work, and that is a great area for all of us to continue to. Leigh, thank you. Back to you.
Thank you, Smita. It's so important because when we talk about cancer, it impacts not only the patient or the person diagnosed, but it impacts their whole family. It impacts their friends. And it also impacts our healthcare, our frontline providers, our oncologists and doctors, nurses, physician assistants. So really there are three different groups of people we can help with yoga in cancer. It's cancer patients, it's the cancer patient family and their loved ones, and it's the medical healthcare providers. So it's a very, very broad, many different cohorts that we can help. So I want to jump to Dr. Bethel. Kelly, so the question is the benefits you see in your yoga practice and some of the challenges that you are facing.
So everyone has covered everyone has covered my notes in terms of the benefits. I think for me, I've had the ability to see the yoga tools can be used across, like we said, the continuum. And that what's the beautiful thing about yoga is that it's a toolbox, right? So it's some days the breath practice might be what you need. And then maybe in survivorship, it is more of an active practice, and those, so that's the beauty of it. You can interchange. And so having that wide variety of toolbox that we can give both our clients, patients, and their families are so important, because really there's something, like we've been saying, across the continuum that yoga has to offer. I think for me, one of the challenges and one of the conversations that we've had at Stoller is that the word palliative care and what that means. And so often palliative care has been associated with hospice and end of life, that I think often we do a disservice to our patients and our families, because really palliative care should be introduced at the time of diagnosis. It's symptom management. So if there's some integrative medicine practice, and I've had the lovely ability to practice as a team with my oncologist, as well as my nurse practitioners, as well as my acupuncturist and massage therapist and nutritionist, and to really be able to look at that whole patient and develop treatment plans around that if we introduce this concept of palliative care at the beginning, and we have to take away that connotation that it's end of life. And we've had oncologists say, I don't want you to mention palliative care, because that you're telling them, you're taking away their hope. And really what we're doing is giving them tools to manage their symptoms across their entire spectrum of cancer care. And so I think that for me is a really important thing that I would love to see happen and it may be happening elsewhere. It may be more to the centers that I'm affiliated with. I think the other challenge that I see, and I don't want to harp on challenges, but the benefits on my list have been covered, is that, it's a very, I've been in clinical practice for 28 years. And so I've watched the evolution as a physical therapist, the evolution of physical movement. And when I graduated PT school back in the dark ages, we were told not to move patients till after they finished treatment. And now we know that they need to do something. And so it's important to keep up not only with the evidence in yoga, and we know that, that it's not just a physical practice, but there's also other evidence coming out now in the PT literature, in the mental health literature, that actually have implications into what we do as yoga therapists. So as the physical therapy world comes out with parameters around safe movement and when is a patient safe to actually do some physical movement, and some of the issues around anxiety and depression that yoga may be beneficial for that have applications in the yoga world, it's really important that we also look at that from as yoga therapists working in cancer care and how they might have a direct impact on what we're doing. The other thing that I find challenging is, as we get better and better at treating cancer, the side effects and things are different. And so it's really important that we stay up on what is the possible side effects of the chemotherapy agents, or what is the possible side effects of this new treatment that we're doing in a study, so that we are providing safe treatment for our patients across their continuum. And then also often it's the yoga therapists that are seeing these long-term effects. So when you see, years out, something that's a side effect of the cancer, making sure that they follow back up with their oncologist and recognizing some of those signs that that these side effects are having that are actually related to long-term treatment effects. I think I'll stop there.
Thank you, Kelly. It's so true. And I think that many yoga therapists develop the close therapeutic relationship with their patients and their clients. And so it's really important for us to be part of the allied healthcare team to be able to make the referrals. If it's something out of our scope of practice, we can refer to the lymphedema specialist. We can refer to a mental health professional, all of these. So this is the best conversation. We've got like 20 minutes left. And I want everybody to have a chance to talk. And Lorenzo especially has a lot to say. So Tanya, you work with children, which is a very unique part of the cancer population. Can you share some of your challenges and some of the benefits that the children and their parents receive?
Sure, thanks, Lee. Just sort of piggyback on what everyone has said. I agree with Dr. Bethel. My notes are pretty solid. I think what's really unique about our work at Children's Hospital is that while we are, of course, patient-focused, within the integrative oncology team, we really have a little bit of flexibility to be able to provide additional family support. Especially during COVID and seeing a lot of the transplant families, you have patients and parents and caregivers that are not leaving the hospital for weeks and months at a time. Social engagement has been really difficult. I think that as yoga therapists, we're in a very unique position. While we partner incredibly with social work and PT and OT and nursing and behavioral health and psychology, we come in with little to no agenda, which I think is really beautiful. And while we may kind of focus on acute care one day, or looking at, one day it could be longer term goals and outcomes for a patient, top of mind is always just providing that therapeutic space. And that can be for a 5-year-old that is experiencing intense fear, an angry 15-year-old, or an adult caregiver that is A, really lonely, and B, very scared. So we've been able to kind of shift and adjust our practice to offer some benefits for caregivers as well. I think what we have seen too is with siblings not being allowed in the hospital setting, there is during COVID, there's incredible needs at home as well. So we've kind of been able to shift gears and provide some sibling support through telehealth, or in the outpatient setting. We have been able to see some children in the outpatient setting as well, some siblings. Challenges, we used to be able to provide group classes, and we are starting to do that again virtually, which I think it goes back to, again, that social engagement piece that is really missing, especially for children and youth, but for parents again as well. I think, we operate on that philanthropic model. So a challenge for us is staffing. We're very fortunate right now to work in conjunction with a larger integrative team. We have an acupuncturist, a massage therapist, a yoga therapist, and an aromatherapist, which has been great. I would love to say that we were all full-time, but we're not. So hopefully one day that will be the case. Yeah, so thank you.
Thank you, Tanya. Working with children is a really special talent when they're touched by cancer. So we thank you so much for your wonderful work. Tina, you are unique. You work in the chemotherapy infusion center and also bedside in the hospital. Can you share your experience and some of the challenges?
Sure, more challenges. I mean, I think the benefits we've talked about, the awareness, breath, and the movement, those are so adaptable to these patients, both outpatient and inpatient. But, it's funny because yoga, there's a curiosity now. It's popular. And I think people are curious about it. And it's good and it's bad because they're curious about it. It's becoming popular, but that's bad because people have the wrong idea about it. Even physicians and staff think, how are you going to do Trikonasana triangle pose while people get their chemotherapy? So there's still so much education that's needed, both staff and patient education. That's a big challenge. Funding, of course, is a big challenge. I'm paid through foundations, but there's always a limit and there's limitations. And one hospital just totally let go of my inpatient services because they were building and they said, you're not coming back until this cancer center is built. So my services were put on hold. Now I'm back, but things like that. So it was all about the funding of the program. Collaboration with staff and referral system organization remains difficult because in some hospitals, there are no integrative, cohesive programs. So I'm just going in as a subcontractor, doing the best I can, working with the clinical staff to reach patients. So the whole idea of patient access to services becomes difficult. And just the logistics in providing inpatient and outpatient yoga therapy services.
Can you, Tina, I'm going to interrupt you. Can you just tell us quickly about the challenges of working with the equipment, with the PICC lines and the ports and the poles and quickly, right, because we're running out of.
Well, safety. Again, safety is the biggest issue. So outpatient wise, a lot of movement is impossible. So a lot of times I will provide yoga nidra, or breathing practices, awareness practices. The movement is, of course, limited. So, I'll have to keep that in mind when I'm providing the interventions for the patients. And inpatient wise, the same applies. You're always looking at a person's comfort. So I address comfort first, because how can people even think about breathing if they're not comfortable? So I'll be providing a lot of props and things like that. So it's really so much grassroots. When I approach a patient, I'm looking at in a very simplistic way, how can I provide comfort and how best can I serve? Does that make sense?
Yeah, it absolutely does. I mean, the other challenges, of course, the pre-medications for the chemotherapy, the Benadryl, the drowsiness, how do you get in and deliver your yoga intervention before they fall asleep? And then just how do you navigate when you have nurses coming in, you have social workers coming in, and you're trying to deliver your intervention. So it's a real dance and a choreography, a real talent to work in that situation. So we've got 10 minutes left. If I'm going to toss it to Dr. Cohen right now, he has a little presentation. We had scheduled this for 1 hour, so if anyone needs to jump off, please do. We can keep going. If Dr. Raghavendra, can we keep going, or do we need to cut it right at 1 hour?
I think we can keep going, no problem.
Okay. So let me give it to Dr. Cohen, and then I'm going to come back and ask the same question to the rest of you, and then we just wrap it on like what are the next steps? How can we work together with AYUSH and with SIO and IAYT? Dr. Cohen, I'm going to hand this over to you for your presentation.
Sure, thank you. So thrilled to start to hear, all this information, in particular from the yoga therapist, because of course that's what matters, what is really going on in the clinics and the hospital rooms. When it comes to the decision makers, of course, they will look at a number of things, not the least of which is, how do we pay for this? But importantly, they're going to look to the evidence. And there's still some people who are, you could say, at best on the fence about, the importance of yoga. And I thought I would just share a little bit about what that evidence is that exists today, in some sense, what's missing and where we need to go. So this is a review that Suzanne Danhauer first authored with a number of other yoga researchers, including myself, that did a systematic review of yoga in oncology, both for patients who are undergoing active treatment as well as into survivorship. And what we know when you look at the literature, in particular, even of randomized clinical trials, is this very steep increase in the number of trials that are being done. And you can see that just 3 years ago, there was over 60 clinical trials completed in 1 year. And, this is increasing year after year. And the evidence is very strong that yoga has an impact on overall quality of life, physical aspects of well-being, both of objective as well as more subjective measures, and importantly, benefits biological outcomes, things like lowering stress hormones, some research showing improvement in immune functioning. So, yes, it's important to improve cancer patients' quality of life, and that's where the evidence is actually quite overwhelming, as I'll show you in a moment. But having an impact all the way into the tumor microenvironment is critically important as well. And we know that chronic stress in particular is a prognostic indicator of worse survival. And we understand the mechanisms whereby chronic stress leads to inflammation, decrease in cell-mediated immunity, over flooding of the body with stress hormones that innervate the tumor microenvironment. And so this is a critical antidote, you could say, and an adjuvant treatment that really needs to go alongside conventional care. Now, are there other mind-body practices that have these similar effects? Of course there are, from multiple traditions, but yoga, as I've written about, is really a quintessential mind-body practice that includes both the physical aspects as well as the psychological and calming aspects. And as others have noted, this can be titrated for different times in the cancer care continuum to meet individual patient needs. Now, in the United States, there's a number of different organizations that we would follow in terms of guidelines for, what should be done with cancer patients. And one of the organizations is the National Comprehensive Cancer Network, which is made up of I think there's over 50 comprehensive cancer centers like MD Anderson, the Harvard Group, Stanford, etc. Many people on this call are part of comprehensive cancer centers, and it is people who come together, the experts from these organizations. They look at the literature and then they come up with what are the guidelines for helping to manage breast cancer, prostate cancer, and in this case, symptoms. And here we see that yoga is listed on the cancer care guidelines, meaning that this is something that should be recommended to patients and ideally provided to patients through our system for anticipatory nausea and vomiting. And you see here some other behavioral therapies like relaxation, hypnosis, relaxation exercises. But this is the first time in 2019 that yoga is listed on the NCCN guidelines for nausea. Next, we see fatigue, again, new to the guideline. We see yoga listed at category 1. Similarly, for cancer-related pain, different behavioral strategies, but the evidence isn't quite as strong as it is for fatigue and nausea. So the statement that the guideline makes is consider yoga for improving some of these survivorship areas because there is evidence. Now, the strength of the evidence isn't as robust as nausea and fatigue. And one of the limitations in the area of yoga and in cancer care is we don't have these multiple large-scale multi-center clinical trials. Another set of guidelines that came from the Society for Integrative Oncology, of which we, of course, are members, but more importantly than what we said was the endorsement from the American Society of Clinical Oncology, ASCO, which is really the authoritative oncology organization. Really people look on that from around the world. And there it was pretty clear that, again, a number of behavioral strategies, but yoga for anxiety, for mood, for overall quality of life. And, the recommendations here being quite clear for a number of these symptoms. So the real challenge here, yes, we should do more research, and in particular, as I mentioned, multi-center and ideally multi-country international trials, both, following fixed protocols for certain symptoms, but also something that we can do now that we've been forced to do is being able to do virtual-based yoga using Zoom-based platforms that is allowing yoga to actually be more accessible than it ever was before. It's not necessarily easy for people in rural communities to come into the center 2 or 3 times a week to receive their yoga care. So we can literally beam into their homes. For those who say, in your institutions that there isn't a lot of evidence for the role of yoga in cancer or for other diseases for that matter, I would recommend this book that we're going to be putting into a second edition in 2022. You see on the right the edition that's available in India for a much reduced price to the UK version. And there was so much evidence on the role of yoga in cancer care that we actually needed 2 chapters out of the 17 medical chapters, one for during treatment and the other for cancer survivors. But there is, evidence for yoga for cardiovascular disease, for women's health, for neurological conditions, 17 different medical conditions listed in this book. And our cancer patients, of course, have that one disease, but the majority have other chronic diseases because, of course, cancer predominantly is a lifestyle disease, and many other comorbid conditions are coming along for the ride. So, you know, this is the diagnosis of cancer, a teachable moment, and yoga is going to help them for getting through their cancer care and thriving during and after. But it's also going to be an important practice to help them in managing many other chronic conditions, and ideally preventing in the first place, and going beyond yoga as asana, pranayama, and meditation, and really yoga as a way of life in terms of diet, in terms of sleep habits, exercise, very importantly, how we manage stress and how we interact with ourselves, each other, and the world as a whole. So with that, I will stop and pass it back to Lee.
Thank you, Dr. Cohen. And actually, the book is on my desk. So I do recommend it very highly. As Dr. Cohen said, there are 2 chapters on yoga and cancer and lots of good research. And it's really fascinating that the NCCN guidelines for fatigue, for distress, for anti-emesis are recommending yoga with strong recommendations to help mitigate side effects of cancer treatment. I want to jump to Beena Patel now because she's got to hop off in a minute. Beena is unique in that she is a physician assistant, and she brings the yogic techniques into her practice as a physician assistant in oncology. So Beena, do you want to just hop on and quickly tell us a little bit about that?
Sure, thank you, Lee. I would say everyone pretty much covered a lot of the reasons I was going to say, but I think one thing that stood out, just like Dr. Cohen mentioned, is that yoga is very individualized. And I think a lot of times, I actually did my master's thesis in PA school on it, that once a cancer patient is diagnosed, they feel that their identity is characterized by the diagnosis versus who they are as a person. And one thing yoga does is it really brings us back to ourselves. And I think that spirit aspect of mind, body, spirit is very underrated. And you'll find that a lot because when you spend enough time with patients, they'll start to open up about how they have these individualized needs. And so I thought yoga, I still think yoga is just so beautiful because a lot of times we can customize even, you know, years of doing a hatha practice for me. That's personally my practice with yoga, but every patient wants something unique and we're able to provide that for them, which is incredible. And I also think, just like Smita brought up, it brings the power back to patients in that they're trying to make a decision. You know, yes, the stem cell transplant is planned out for them, chemotherapy is planned out for them, but when it comes to anxiety, can they choose a yoga or meditation practice? You know, if they really like going to the beach, can we introduce ocean waves and, you know, those different pranayama and breathing techniques versus going straight to Ativan? And you'll find that a lot of patients, if you spend enough time with them and educate them, they actually are asking to be educated about more of these other techniques versus going straight to medications. And I would say a big challenge that I found is that it really is up to clinicians and a lot of healthcare providers working at the forefront to be able to mention things about integrative medicine, because without that education, not all patients, but some patients really won't have any idea of what is available to them. So it really is up to us. And I think the last piece, challenge that I've noticed is that in a lot of the bigger academic centers, even though integrative medicine is a growing area, like growing department in a lot of these places, we still don't have enough staffing. And so I've seen patients who they might ask for yoga or meditation and we've had to put off a session for maybe 2 days. And I think that doesn't really help for patients who's having acute anxiety before treatment. So hopefully we can increase education, increase awareness, and more people will hop on board because ultimately it's about the patients. Thank you.
Yeah, thank you, Beena. Thank you so much. Suvina, are you still with us or did you hop off? You are muted. Unmute yourself.
Sorry. I was about to hop off, but just really quickly, you know, like Bina said, everything pretty much has been covered in terms of why there's a need today for having this conversation, and why it is so important for some of these patients that are so immunocompromised to use some of these tools to help them with all the side effects through their treatment, from the diagnosis to end of life, that this conversation is very timely and relevant. Where I've seen the challenges, like many of our speakers have mentioned, is the education piece from our caregivers, from support staff to the physicians, to wherever they get their care. I feel like the community is not educated enough about the benefits that yoga can offer. Most people see yoga as a exercise technique, as a skinny body technique. Dynamic yoga practice is what is etched in everybody's mind as far as awareness of yoga goes. So some of these tools that we can give them to help them manage some of the cancer burden, the pain, the anxiety, the nausea, I think is very, very important. And I hope that we continue this. I work primarily in the treatment space, so I see many of them in some of the most immunocompromised states. And I find that, my therapists, whenever they see somebody that needs that kind of assistance, they always reach out to me to come provide that. And I see that I am making a difference in their lives by giving them access to this care, brief as it may be. I do also see one of the challenges that, and this is, I'm sure all of you across all the spaces are seeing this as well, is the adherence. Cancer patients, because they have so much to manage, along with their disease burden and the symptoms and the challenges that they're facing, they have a hard time adhering to yoga practice. So many of the times they often forget to do their own practice at home for self-care. The only time they get to practice is when they are with you as a yoga therapist. So I find that it is important when I spend my time with them, it is one-on-one time. This is my time with them. They feel that this gives them back their sense of power. This makes them feel like there is somebody out there that cares, and just kind of provides a connection that sometimes gets lost when they're diagnosed with cancer. So I'm going to hop off here, but thank you, Lee, for starting this very important conversation.
Thank you, Savina. So Savina and Bina both are healthcare providers. Bina, of course, is a physician assistant, and Savina is a radiation physicist. So they spend time with the patients while they're in active treatment. And so it's, I think, imperative for us to train our healthcare providers on techniques of yoga so that they can incorporate into holistic patient care. I've got an eye on the clock. Very quickly, Sanmei, very quickly. Hold on. You are unique because you use yoga as prevention and early diagnosis. Quickly.
Yeah. So very quickly, and most of you come from within the system, as doctors or nurses or therapists or physical therapists. I come from technology, so I'm actually like ex-CIO of County of Los Angeles, and so I see things at a different level. I see a lot of, at least in my area, a lot of resistance. I've talked to very senior doctors in City of Hope, while in private they agree, but there are systemic challenges in implementing yoga as an integrative practice throughout, and I have seen it in Department of Health Services, where I was in a lead position and executive. We had those challenges. So I do this as a lot of nonprofit basis within the wellness of county as well as outside. So a couple of points, and most of it has been covered. One is pre-diagnostic, early diagnosis. A few cases where I have developed some techniques along with some, which I learned basically from Vyasa, where I did my master's as well as a postgraduate diploma in yoga therapy. Developed some techniques using some of their techniques to go deep into an interoceptive point of view where you can learn how to see the signals of your body. So there are several cases I have seen, specifically 2 cases of breast cancer, that they could diagnose their breast cancer very early, and that really helped them out. And then I followed through with my techniques. I use a lot of technology. I use Zoom. I have my own little app called Dr. Yogi. I use all of these technologies to help people, you know, online, offline, you know, with meditation, with pranayama, with sukshma vyamas and other things, depending on the situation. So that's one thing. The other thing is, so it really helps. So people have really figured out, you know, there's a case where they found, she found something wrong in her breast, and then she went to the doctor. Doctor said, yeah, it's something there. You know, they did all the scans, and they said, well, how could you find out? And so there it goes. I mean, the power of interoception, power of listening to your internal signals. There's a lot of people don't even believe in that. A lot of modern physicians don't believe in those things, but things are changing. The second point I would like to make, because I'm also studying Ayurveda, that very important for yoga therapists as well as people like us, most of us, we need to introduce or incorporate some of the basic foundational principles of Ayurveda in terms of analyzing the bioenergies, the dosas of people, which can help in picking and choosing the right kind of pranayama, right kind of vyamas, right kind of techniques, right kind of meditation for that particular type. So that will give our hit ratio, improve our hit ratio to a much better level than what it is today. Mm-hmm. Big problem with yoga is newer to the West. Not many studies are still there. I thought there was like 3,000 good research papers, which is nothing compared to the subject of this kind. And I think it will take a little bit longer. The third point is AYUSH and maybe some powerful governing bodies in America. They need to talk to each other. And you know, Narendra Modi has done a fantastic job in India and other countries. I think there has to be a push from India to the powers to be in the United States to make this, to look at it as a very in a comprehensive manner, rather than, oh, yoga, and then, oh, Vikram yoga, heart yoga, and, you know, leg up, and, you know, beautiful men and women doing a lot of crazy stuff, not that kind of a thing. So I think there are a few fronts we need to open up and work to make this as a core part of cancer treatment or any treatment. You'd be surprised that, you know, I go to my pulmonologist and he gives a medication, and then I said, well, I didn't use it. I did my pranayama and improved my condition. And he would say, what is pranayama? So, so that level, I mean, these are very accomplished people, but I think education is a big part, and that has to come from the top. And I know we SIO and others are trying to do the best, but it really, if you want to be effective, it has to come to the top. Yoga was lost in India. It has come back after the Modi government, and so it has to be at that level to make it to do it very quickly and very effectively. That's it. I talked more than I should have. Thank you.
Thank you, Sanmay. Thank you so much. I mean, it's very interesting, this idea of interoception, and in a yoga practice taking you so deeply in tune with your body that if something is there's a change, you can recognize it and then go and have some medical guidance around it. I've heard
and it's not only just cancer, Lee. I mean, you know, if you have a mild bloating, sometimes people don't even know whether they're bloated or not. And in my Ayurvedic practice, I'm seeing this. But if you are interoceptive, if you understand your body through different techniques, you could, hey, something is going wrong here. You can early detect, in 90% of the cases, if you learn how to do it. It's so important to do that for preventative situations. Yeah.
This is so true. This is so true. Raghavendra, it is 10:15. We've been going an hour and 15 minutes. We have 3 yoga therapists. What would you like to do? Would you like to do a wrap up and next steps, or would you like to spend time hearing more?
I think let's wrap up. So I would just like to, before we even wrap up, we were just thinking about what are the things which can be done with AYUSH collaborating with SIO or vice versa. So that is one aspect. Before I go into this, just to tell, I'm very happy and to hear a lot of thoughts and thought processes from various yoga therapists, oncologists, doctors who are involved in the care of cancer patients. And a lot of thought processes are going on, and I'm sure in days to come, we'll devise means and methods to improve the care of cancer patients in your country. What is important today, based on all the topics which we have discussed today, is to look at how do we enhance awareness about yoga. I think most of you also put it very rightly that we need to really bring awareness about yoga, educate the doctors, educate the oncologists, educate the fence sitters on various aspects of yoga. So how do you do about it? What should be the steps taken? So we need to formulate certain programs, awareness programs, education programs, probably have more webinars and even conferences as well, wherein we can take the message of yoga to the oncology community. Second thing is we also have to develop practices and modules which are very simple and easy on patients, because yoga is something which is to talk about calming of the mind. It doesn't require always a movement. It just requires awareness on the breath and control of the breath also. And we need to try to, we can achieve the same outcomes, simple practices for these patients, which are easy on these patients, without doing all the dynamic postures or movement therapies, etc. Third thing is we need to use technology platforms for delivery without any trade-off on the personal touch. So we need to see how to make this happen. For example, if you're going to be using a Zoom platform for delivering the yoga intervention and post this delivery of the yoga intervention, how do you connect with the patient without even because when you do a one-to-one session with the patient physically present, it's a different thing altogether when you do it on a virtual platform. So how to bring that connect with the patient when you do an online platform, that is also very, very important, because you need to see whether when you say the patient to become aware of the breath, relax, and to do all those things, whether it's really relaxing or not, you'll not be able to find out. Okay, because when the patient is there in front of you and when he's doing a shavasana, when you're observing him very keenly, you can get all the cues. You can feel the body cues and know how much attention the patient is paying to your instructions, and you can really gauge the patient's attention span and this capability in going up in the practice. But does not happen in an online scenario. So can we develop tools to measure relaxation response online? So there are again some of the innovative things which we can do. We can develop a smart. We have developed a smart yoga mat here, which we are validating in COVID patients now in India. Okay. So the fourth one was to develop training programs and courses which can be endorsed by Ministry of AYUSH, especially for yoga therapists in oncology, so working with cancer centers. And that will go a very long way. If all the experts come together, we develop a very nice concise booklet only on oncology and yoga therapy aspects of care for different management of various symptoms in cancer patients. That will really be wonderful because it helps in setting up standards. It helps in setting up uniformity of care across the world. And that will be, it doesn't matter which school of yoga, you have the principles for management of each symptom. And that could be one of the important steps which we can take together. And last one is also to develop international collaborative studies. And Dr. Lorenzo was talking about today morning, why don't we look at developing an online yoga module and online yoga intervention for patients, and let us validate and test those kind of process. And we are welcome to do that. I think let us put up study together and see how this can be funded and how to take it up forward in a large scale in both US as well as India. So I thank Lee. I thank all the people who are experts who are here, who have spent their valuable time, who have spent their valuable information and expertise, for sharing their expertise with all of us here. And also thank Dr. Lorenzo for his everlasting support He's always there whenever I call him. He's very, very obliging. And thank you, Dr. Lorenzo, for having spent your precious time. And it's a wonderful session to insight into the evidence level for yoga. It's very heartening to see that yoga has got into the ambit of guidelines now. So that's a very, very heartening news. And this is what should happen. We have to convert these we have to do good amount of research and develop good hard evidence, good level 1 evidence, so that these can go into guidelines. And once they go into practice guidelines, they also get insured and they also get paid for. And that is when you would have this yoga therapy sustaining. And I think that's really the way to go. I'm sure with the kind of research which all of you are putting in, the energies you're putting in, I'm sure this is going to happen in a few years' time. And I wish you all the best. And thank you all for being here. Thank you so much, Lee. And thank you, Lorenzo, and all your colleagues. Thank you so much. Namaskar.
Thank you, Dr. Raghavendra, very much.